My name is Dr. Hildegarda Aloyce from Tanzania. I'm working in a tertiary hospital in my country known as Muhimbili National Hospital as an obstetrician and gynecologist for 10 years now. I was recommended by my Ministry of Health to attend Merck Foundation Embryology Training Program. Okay, in my country, Tanzania, we don't have the actual number of infertility. As we know, there are a few studies which has been done to determine the prevalence. But according to our gynecological clinic registry, 3 to 4 out of 10 gynecological cases are due to infertility. So you can see we have a big number of infertility couples in our country. And as far we have only 5 private facility which provide fertility services like IVF, and we don't have currently the government facility which providing IVF service. But in our tertiary hospital, we are about to establish a public IVF unit. And as you know, we have a lot of infertile couples. We still have challenges because we have few facilities to provide those services, and the awareness of the people, they don't know when to seek and where to seek, especially those who are in the rural areas, because these facilities which are available, they are only in the urban areas. So also the cultural and belief, people, they still seek, you know, infertility has no pain. So people, they don't seek the medical advice early or until when it's quite late. The key things to improve in fertility care in my country, one of the most important thing, to raise the awareness. You know, people, they still have that, infertility still has that social stigma. People, they don't seek for the health care advice, especially for male factor infertility. You know, male, they do think infertility is due to female cause. So we have to raise the awareness so that they should seek the care as a male and female partner together, and also they should be treated for sexual transmitted disease in order to prevent them to become infertile. Also, as I said, we have a few IVF facilities or fertility clinic. So it will be good to improve the fertility services by increasing the number of clinics, even in the rural areas, increasing awareness, establishing IVF services which will be affordable. You know, most of the people who suffer infertility are of the middle class age, and you know, as we know, IVF services are still expensive. If we can do a way to reduce the cost to become affordable to the middle class, it will be good. The current available fertility care in my country, it including IUI services. There are some places they provide IUI services, intrauterine insemination, after doing minimal stimulation by using clomiphene, letrozole, after being sure the tubes are patent. Then we can do minimal stimulation and doing IUI or timed intercourse. For those with anovulatory cycles, we have been regulating their cycle and counseling the women about their menstrual cycle. You know, some women, they don't know fertile days of their menstrual cycle. They just suffer infertility because they don't know their fertile days. So we have to educate them when they come to clinic to know their fertile days, then to make sure their tubes are patent, then we can keep them on minimal stimulation plus timed intercourse. Also, we have those few IVF services where for those with tubal blockage or with male factor infertility with very low sperm count, we encourage them to go to those clinics to do IVF if they can afford. The Merck Foundation training has become so beneficial to me. I can say I was privileged to get this opportunity because it was my dream to get opportunity to get the right knowledge about how to manage infertility and the treatment options which are available. So for this training, I acquired the right knowledge with different treatment modalities for the infertility. So with this knowledge which I acquired, it will be beneficial to my patient, because now as a clinician and as an embryologist as well, I can manage those patients who suffer infertility in my country. The awareness of male infertility in my country is less. People, they have less knowledge. You know, men, they consider themselves, as long as the man can have a good manhood, that meaning has a good erection with ejaculation, they consider themselves as being normal. So the society also perceive infertility just because of the female fault. So you may find the infertile couple, the man will leave the woman and go to remarry and remarry and remarry. They don't accept infertility can be due to male factor. They are very reluctant to come to the clinic, and most of the time you will find the female alone come to seek for the infertility services without coming with their partner. Yeah, my expectation from this training program were all covered, because my expectation were to know the right treatment modality, how to do IVF, IRSI, all the treatment option and the investigation for the infertile couple, and they all were met. So I can say I'm satisfied, all my expectations were met with this training. During this training program, I got opportunity to be trained on how to do proper investigation of infertile couple, meaning the female and the male partner, which are the basic and very important investigation to be done. And also I got the opportunity to be trained in the lab part and to be trained on the lab equipment. After this training, when I go back to my home country, as we are about to start the IVF center, we'll use this knowledge now to train the others there at my working place. Also, I will use this knowledge to prepare cases for IVF and IUI. Also, through this knowledge, I will prepare the SOPs for the lab, how to do the proper IVF and proper recruiting of the patients. Okay, my advice to the new aspirant of the next batch of this program, if they can have just doing revision of the infertility causes prior of coming, because the time is short, it's just 3 months for this course. So once they revise those causes, it will be easier for them to grasp the knowledge which will be given to them once they are here for the course. I would like to thank Merck Foundation for the opportunity which has been given to me to attend this embryology training program. Also, I would like to thank the Ministry of Health of my country for recommending me to attend this program. Tanzania.